Assalamu alaikum wa rahmatullahi wa barakatuh. For today, our session about the ECG, electrocardiography. Electrocardiography, it is the detection of the electrical activity of the heart. The heart, if you refer back to your anatomy and physiology, you will remember that there is the SA node, which is present in the right atria, in the muscle of the right atria. The initiation of the impulses, it is coming from the SA node, then it will travel to the AB node, then to the bundle of His and right bundle and left bundle branch, then to the Purkinje fiber. That impulses during it is travel and it is stimulation to the muscle. This ECG leads, it will detect the activity of those electrical impulses and it show them on a graph. So any deficit or any problem within the transmission of the electrical impulses in the heart muscle from the SA node to AV node to the bundle and to the bundle branch and to that interfere with the contraction of the heart, it will appear in those, it will be detected by those leads. So there is inside the cell usually the charge is a negative charge, outside it is a positive charge. We call it the polarization, this one. Then it will be changed due to the stimuli. When the SA node, it is working automatically by itself. It doesn't have any stimulation from outside. So the initiation of the impulse, it starts from the SA node. So polarization will be there. Then it will create what we call it the B wave. So the B wave in the isoelectric line, which is coming up, the positive wave, it is coming the first positive wave, which is the B wave. It will give us impression about the work of the SA node, the impulse which is coming from the SA node. Then the impulse, it will be traveling from SA node to the AB node. When it reaches the septum, there is a delay. That delay, it is around 0.1 second. So it will appear as a flat horizontal line with the isoelectrical line. Then there will be the depolarization. So there will be a negative depolarization, which is the appearance of the QRS. So the QRS, it will start with the Q, which is a negative downward, then the R, which is resembling the contraction of the atrium, the ventricle, sorry. So it will resemble the contraction of the ventricle. So the QRS complex, it's give us an impression about the transmission of the impulse through the from the AB node to the bundle of His, then the contraction, then to the bundle branch and to Purkinje fiber, and the compression of the heart muscle. So this is the QRS complex. Then we have the S. After that, there is the T wave. The T wave, it is the depolarization of the SA or the atria again. Sometimes U wave is there, but usually it is not appearing. We are using for that purpose, we are using what we call it the 12 leads ECG. The 12 lead ECG, actually there are 10 electrodes that we are using for detecting or the heart activities, and in order to get that 12 leads. How those 12 leads are working, how this work. So there are 6 leads of the chest from C1 to C6. We are putting them on the chest. We are starting the first one we will put it in the 4th intercostal space at the right side of the sternum. The second one, we will put it on the 4th intercostal space to the left side of the sternum. Then we will go to the 4th lead, or C4. We will position it at the mid-clavicular line below the nipple at the 5th intercostal space. So it will be here. So here we got the second, the 4th is here, then the 3rd, it is in the 5th intercostal space between the 2nd and the 4th. We'll go to the 6th lead 6, or C6. It is at the mid-axillary line, and also it is the same level, the 5th intercostal space, but in the mid-axillary line. The 5th one, it is in the anterior axillary line. It is in between the lead 4 and 5 at the same level, which is the 5th intercostal space. So this is the position of the chest leads. The other 4 leads, which is 2 leads for one in the right hand, the second in the left hand, then the 3rd on the right leg, the 4th in the left leg. By the way, the chest lead, it is called unipolar leads. So they are detecting the electrical activity lead one by one. So each one is detecting the electrical activities from that side. The leads which is on the limb, the 3 leads, right hand, and left leg, they are working in 2 ways. They are working bipolarly for lead 1, lead 2, and lead 3. So they are working as a bipolar leads. So they are communicating to each other in order to detect the signal. The AVR, AVF, and AVL, they are the same leads, are detecting the unipolar activities. So from that side. The leads which is on the right leg, it is used as an earth for the communication. So it is not detecting the electrical impulses. So it is needed for an earth. So this is how we will put the leads and how they are looking. So they are looking to the heart from different angles in order to detect the changes in the pulse, in the waves while it is conducted in the heart muscle and the contractility of the heart. So it will give us an impression about the heart, how it is work, and if it is contracted well or not. This will give you the direction of the view of the heart wave in lead 1, 2, and lead 3. So you can depend on them to show that.